Bismillahirrahmanirrahim. Hello everyone. Assalamu alaikum. From today we are starting a series of lectures for my dear students and colleagues. I am Dr. Zainab Javed, clinical psychologist. I am starting from my favorite disorder, OCD, obsessive compulsive disorder. As you all know that OCD is a subtype of anxiety. Before understanding OCD, it is extremely important to understand what is anxiety. Anxiety is basically thoughts about future. This will happen, that will happen, sudden event will occur, I will fall, I will die. Any thoughts that are related to future comes under anxiety. Anxiety has many disorders like panic disorder, OCD, illness anxiety, and phobias. Today we are going to study OCD. OCD is known as obsessive compulsive disorder. In obsessive compulsive disorder, we have either obsessions or compulsions and even both. Now, what is obsessions? Obsession is a thought, a very intense thought, urge, wish, desire, and even it can be an image. It is so intense, so disturbing that a person is forced to do that thought. He or she is unable to control their desire. These thoughts are of various types, and when he is unable to control his thought, he performs a behavior, and that behavior is known as compulsion. For a diagnosis of OCD, this OCD should occupy at least 1 hour per day. Obsessive compulsive disorder is extremely painful. There are four themes or four types of OCD. Like some people have cleanliness OCD. They have a thought that they are contaminated, their hands are not clean, their room is not neat, their clothes are not neat. And to satisfy their thoughts, they perform compulsions, behaviors that they wash their hands or they clean their room. Similarly, there's a second type of OCD which is known as symmetry. They think that they have not completed a particular order, and in the result of compulsion, they repeat that order. Like if they're doing a religious prayer, they will think that they have not completed it in a proper sequence. They'll repeat it again and again and again. Forbidden OCD is a very traumatic form of OCD because it challenges your religion and your sexual needs. So the person suffering from forbidden OCD is in a lot of pain. OCD of harm. In OCD of harm, a person thinks that he or she is going to harm someone, and as a result, he goes and check that. Sometimes it is so delusional that a person it thinks that he has done it. So as a compulsion, as a behavior, he goes and checks again and again that if he has harmed the person or not. We need to understand what are the reasons of OCD, what causes OCD, who is behind this disorder. So let's study the etiology or reasons of OCD. Psychodynamic perspective, one of the oldest perspective in psychology of Sigmund Freud. As Freud says that OCD occurs as a result of fixation in anal stage, it can occur as a result of very strict toilet training. Such people get OCD of symmetry usually, and there is a lot of research literature supporting it. Cognitive perspective says that people with OCD try to suppress their thoughts, and as the result they come out like a volcano. So this is one of the most unhelpful techniques people do. They try to distract themselves, and they run away from their thoughts and their thoughts run after them. So that is the cognitive perspective. According to the behavioral perspective, that OCD is the outcome of people blaming their obsessions and compulsions on themselves, and therefore they have irrational thoughts of bad things arising if their compulsions are not acted upon. Biological perspective says that OCD can run in your genes. It can occur due to low level of serotonin, or it can occur due to some problems in your regions. I am sure every one of you is interested to know how to get rid of OCD, and all of you are interested in the management. Either you are my student or you are the client. So hopefully in the next presentation, I'll be sharing a detailed management slide. Till then, wait for the management and do let me know what are your problems of OCD so I can make management lecture according to that. Thank you so much.